you. Good to see you.
This is the first time that I've talked to you since you're a medical doctor. And, before you were just that girl on the stage.
Yeah.
And now it's like you just have been doing so many amazing things that I can't wait to talk to you.
Thank you.
So, Dr. Jaya, I was told, and I'm not going to continue to call you doctor.
Yeah.
I'm giving you all those kudos for your medical degree. I have to tell you, first of all, you're a new mom.
Yes.
All this year, you're a new mom. You're an actress who had a movie that got all kinds of accolades. And you're in the middle of coronavirus as a doctor in a hospital.
Yeah.
Could your life have been any just more impactful, basically, in 6 months? I mean,
it's the whole thing. I mean, it's nothing that I ever could have written. It's stranger than fiction for sure. I mean, I never anticipated, as you know, because we've been friends for a while, I never anticipated being a doctor, but then now I'm a doctor in the time of coronavirus. So it's like, I did not see this coming at all, because I work in the hospital. So I see the sickest patients, and it's wild. It's wild.
When I want to tell people how I met you.
Yeah.
I believe that I met you and we were throwing around dates. So it goes back to 2012.
Yeah, I think so.
And you were one of the lucky people who got called to sing Daydream Believer at the Beacon Theater in New York.
Yep.
That night, there were celebrities in the audience. I remember looking at Brian Williams and going, "Hey, you're Brian Williams," and
Right.
Fred Armisen, and going, "Oh, you're the guy from Saturday Night Live."
Oh, I didn't know he was there. Cool.
Oh, there were celebrities in the audience there. And if people weren't at that show, it was Mike Nesmith, Mickey Dolenz, Peter Tork, and when they first went on the air, when they first after Davey passed away, they did Daydream Believer, and they would call a random person up.
Right.
And this hot, gorgeous Indian woman with the I Love Davey shirt on.
Yes.
Gets on the stage, and I just never could forget you, because that was like, oh my gosh.
You could not have written, oh, look, Mona said it was December 2nd, 2012.
Okay, so I said it was December 14th. So I was pretty close in knowing it was December.
Yeah, that was, it's like it was out of my head you could not have designed. It's one of those daydreams. Hey, I'm literally a daydream believer now. It's one of those daydreams that you have, and you're like, well, that'll never happen. And then I still can't believe that happened. I mean, I still can't believe it. It still makes me like nauseous in an excited way to think about.
What's amazing, and you went to the convention also, didn't you?
Yes.
Because I know I've seen that photo of you with Mike and Mickey and Peter.
Yes. Yeah, and my mom and my sister, and I can't remember if Jacob was there the first one or not, but at least, my friend Julia, that's who was there at the first Monkeys convention. Yeah, that's right.
That was the Davy Jones Memorial Convention.
Right.
Is that right?
Yeah.
That's when I was crying too.
Right. Yes, exactly.
Okay, so that was 2013.
Okay.
The Davy Jones one.
Okay.
God, it must be, because that has something to do with my password for my page. So yeah, it was 2013.
Okay.
So catching everybody up, since you were on stage with the Monkeys, you have become you were on Say Yes to the Dress.
Yes.
Got married. Actress, baby.
Yep.
Coronavirus. So now everybody is caught up on the relationship.
That's it. That's my life in like one sentence. Absolutely.
So you work at Christie's Highland, and at the hospital in Louisiana.
Correct. Yes.
I've never been to Louisiana.
You were supposed to be here in April.
I was supposed to be there in April, and now I'm not going to be there for a little while
Oh,
because of everything going on.
right.
And that's kind of what I wanted to talk to you about. So the other day, I had posed a question about would the fans go to a concert wearing a mask in the state of the way that the country is right now? Because one of the ticket agencies put out what they thought the new rules were going to be, that
Oh,
you buy tickets in pods of 5 people, pods of 13. They're going to take your temperature before you go into the stadium or whatever,
right,
and you would have to wear masks. I, for one, said I would not go to a concert
right,
under these circumstances. I don't feel comfortable wearing a mask for 2 hours. I guarantee you, I will not do it. I will find every reason, as I'm sure a lot of other people will, to take them down, up, whatever.
right.
Um, I was discussing with Mickey last night that I don't understand how, or if it's possible, they can sell food or alcohol if they're implementing masks, because unless I'm missing something, you need to lift your mouth, your
Right.
mouth.
Yeah.
And I don't feel comfortable that if a TSA agent can miss a bomb in a shoe, how can you tell me that you're going to see 5,000 people at all times
Yeah. There's
not
no way.
fiddling around with their mask?
Right.
Would you, at this point, go to your favorite band's concert? Being a doctor and what you're seeing.
Yeah, no, I would not. I mean, as much as it pains me, I wouldn't. I don't think that there's any, we haven't even gotten near the point where we could consider doing something like that. They have 3 phases rolled out in this coronavirus task force that they have for phases of reopening. And I think, large venues are at the end of that. So we would need a lot more improvement in the number of cases and available treatments before we could even get. But no, personally, I would not attend a concert for several reasons. The first is that being a physician treating coronavirus patients, I don't want to infect anybody else because you can have it for 14 days with no symptoms. So I would be very conscientious about me not giving it to someone else. And
So
then,
would you be
yeah,
considered what they're calling a carrier at that point?
right. If I had it and I didn't have any symptoms, you can be a carrier for up to 14 days, possibly longer, but 14 days is the time frame that we've been using for now.
So if you were to go to a concert right now, you're a carrier, let's say,
Right.
you are really getting annoyed 2.5 hours. You want to sing a song.
Right.
You pretend that nobody can see you.
Right.
You cough or sneeze. How many people realistically can get infected in one cough or sneeze if you're in a crowd of 200 people?
It's unlimited depending on the distance that people are around me. So
Mhm.
anyone within 6 to 10 feet, there's no limit on how many people could be affected in my immediate vicinity. But then you have to think about you're all sharing ventilation and circulation of air. So they still haven't determined how long the virus lives in the air, not to a definitive point. So if I cough or sneeze or talk, you don't have to cough or sneeze. You can just be talking or singing along to a concert, right? If that virus travels and is able to stay in the air long enough, it could be unlimited numbers of people. So, I mean, that is so scary to me. I would never want to risk that.
So the movie Outbreak, did you ever see that movie?
Yes, I tortured myself with Outbreak and Contagion right at the beginning of coronavirus because I'm a sick person, I guess. But I really appreciated the way those movies approached virus transmission because it's very accurate. I mean, we're not dealing with like a flesh eating, like our faces exploding kind of virus, but in terms of how it's transmitted, and I mean, I thought they actually did a really good job on that.
Every time I saw that movie, I guess I had to have been more of a kid. I mean, that movie's got to be outbreak has to be like probably almost 20 years old if I
Yeah,
had
I
to
think
guess.
so.
And I remember when they would show somebody sneeze or cough,
Right.
and they showed the little particles. And even though it was a movie, every time I'm at an airport and somebody sneezes, I immediately want to yell outbreak
Right.
because I get sneezed out anyway,
Yeah.
But um, so see, realistically, what I'm thinking is if you're saying 6 to 10 feet, one person needs to just carry it, not even have it themselves.
Right.
So those, let's say 20 people, because of a circumference, let's say those 20 people now have something gross on them. They now are in another crowd with 20 people each.
That's how it
So
works.
assuming it's like the domino effect, is that
Exactly. Yes.
right?
Yeah, absolutely. Yeah.
See, what really had me more upset the other day was, and I love everybody. The fans are amazing. Their immediate reaction was, "No, I wouldn't want to be the one to get Mike or Mickey sick with coronavirus."
Right.
And I'm very quick to say, "I don't want you to get it. I it's
Right.
we understand them, and you're looking at them as two older gentlemen who you see on television and know you don't want to get a celebrity sick,
Right.
but I'm more concerned about the everyday person who's more concerned about the two men, when you don't realize that I and other people, though we look healthy, have underlying conditions
Exactly.
that I might get this, God forbid, drop dead faster than the guys that I work with."
Right. Right.
And I think people tend to forget about the celebrities. Why aren't you more concerned about yourself, your daughter, your son, your mother,
Absolutely.
your father? I don't, am I looking at this from the wrong perspective?
No, that is absolutely the right perspective. I mean, I think depending on where you get your news and your sources, that there's some thinking that, well, this is only going to affect really really sick people who are already very sick already. So not someone who looks like you, Jody. You would never think. That's what some of the thinking is,
Right,
and it only affects people who are over a certain age. But I can tell you, even though people in a certain age bracket over 65, as well as people who have immunocompromised conditions, are certainly at risk. This virus does not care. The virus is not going to look at you and go, Jody looks pretty good. I don't think I'm going to infect her. And without sharing patient specific
sure.
information, I've treated several people with coronavirus now. And I had two patients who were 60 years apart in age, and the younger one got way sicker than the older one. And I think that's shocking to some people, because you don't think a person in their 20s could get that sick, and the other person was in their 80s. So
Yeah.
we see it every day. So everyone should be careful. You should definitely, just like you said, be thinking about it in the context of, if I get this, who am I going to infect, including myself? Because right now there's no vaccine. I can tell you from a doctor's perspective, there's still no good treatment, unfortunately. So now is not the time to get coronavirus. Now's the time to do everything you can not to get this virus, because once you get it, there's no telling how it's going to truly affect you, which is very scary.
So we shouldn't ever, I mean, this is the worst time to prejudge a situation.
Absolutely.
I mean, what a lot of people are saying are the demographic that go to a Monkees concert fall directly in this demographic. But that's again based on the media telling us that the majority of people that are dying are over a certain age. You just have no idea. And then something I was really actually, I have certain women that I'm very close with that I don't want to say my being naive, but I figured, because I'm not a doctor, much like Donald Trump is not a doctor, I don't pretend that I know what I'm thinking or talking about at any given time. I watch television as everybody else does. So I started thinking, well, we can have a smaller scale event. We can,
Right.
I know this one will come, this one will come, this one will come. And then I'm going to tell you, I'm actually going to name drop Shirley Prepke, who is in Oregon. I love her and her daughter. Rebecca and Shirley come to all the events from Oregon. And she pointed something out the other day because she said, no, I wouldn't go at this point. And I thought, now she's one of the ones that I would think would be
Right.
like, oh, ladies' weekend. She made a point I didn't think about, which is why I love asking real questions to people. It was going to the airport, sitting
Mm.
on the plane,
Mm-mm.
going to the other airport, getting in an Uber, going to the hotel, going to the rest. It's the 19 steps before you go and you even see the couple women that you want to actually be with. Because I look at my friends and I'm like, they're clean. I'm going to give them a hug. I don't,
I
what
know.
am I thinking
I know.
so irresponsibly, right?
Yeah. Well, I think and you and I are both extroverts, so this is just like so difficult from a mental health perspective because we need people and contact and socialization, but it's just, it's just not worth it at this point, and it's so difficult to make sure that at every step, I mean, that's a really good point that Shirley made. It's so difficult to know at every step that you're protected. The only way to know that is to do what we're doing right now, which is social distancing and safety protocols.
What do you now? When it comes to watching the news, when this whole thing first started a couple months ago,
Yeah.
thankfully I was already dealing with a surgery, so I was fine. I was not going anywhere anyway.
Right.
I would sit and watch the news all day and night. I did the same thing with 9/11.
Yeah.
I never turned the news off.
Right.
And 2 months into this, I wake up, I say to my husband, what now? Nothing, same shit, different day.
Murder
And then,
hornets.
right. And now we're watching everything else except for the news.
Yes.
Is there a point where it's just enough already? Or is every day important that we get the updates on the news?
No, I mean, my parents are split. My dad watches everything for like 8 hours, and my mom doesn't want to hear any of it because it really increases her anxiety. But I would say there haven't been any new developments for like 2 or 3 weeks. If there's some breaking news like a vaccine or a treatment or a change in how we're approaching things, you're gonna hear about it. So to me, for most people, watching the news every day is increasing anxiety rather than not. So I don't think that there's any real benefit. I would check in with a source that you find reliable every day for 10 or 15 minutes and then turn it off because you will drive yourself crazy.
Now, not getting political or anything, but every day we were watching Cuomo for about an hour and a half,
Right.
his conferences every single day.
Right.
Trump stopped doing them, but it was more because I think he was getting so beat up. It wasn't and unnecessary. What now? Whether Cuomo is no matter, I don't care what his political affiliation is. At some point, an hour and a half is too much.
Right.
Of is that right? Like he means well, but it's too much.
Yeah,
And
I agree. Yeah, I mean, I think it was really helpful when it all first started because he's providing a lot of valuable information, a lot of support. I love the interviews with him and his brother. I think those are hilarious.
they are funny.
They're really funny. But yeah, I think at this point, because everyone was just trying to learn as much as they could about what was going on in this virus. But at this point, I feel like we know what we know. So there may be a weekly update or a breaking news update, but I don't think an hour and a half every day is that's just oversaturation.
Um, that's what I was thinking because I was getting so addicted to
Yeah.
it
Right.
that I was finding myself being more angry and combative,
Right.
and then more skeptical of the media
Yes.
than than anything else, because I've noticed, and a lot of people don't pay attention, but the media loves this stuff. I
Of
mean,
course.
anybody who doesn't realize that that the worst tragedy is where people in the media make the most ratings. That's where the sponsors are. This is the best thing that happened for
This is
television.
it's business. It's good business for them.
Right. If it what people don't realize that if they turned on the news right now and they go, it's sunny, everybody's cured, there's a sale at Walmart,
Right.
that's the end of watching the news.
Right.
If people don't realize that the whole point of the news is to go, there is a really big problem. We'll tell you more at 11 o'clock at night.
Exactly.
And then they've got, if you notice, some of the, well, I've noticed here, we have Fox News. I don't know if it's the political part, but this really hot guy who is on our news, they had him grow a beard. And my husband kept saying, "What the hell? Why they have him in a beard?" And I said, "Probably because you take him more seriously." Sort of like the old Abe Lincoln. If a
Ah,
lot of these men, they're trying to mature them up so that they look more of the part of authenticating the news, because
right.
what would some good looking guy know about coronavirus? I
Well,
really feel like they're trying to be the part of the disease instead of,
right. Yeah,
you
and
know,
growing a beard is a terrible idea because then the masks don't get the appropriate seal. That's
wait a
actually a
second.
terrible idea to grow a beard right now.
So wait a minute. I didn't know that. So facial hair is,
Yeah.
is a bad idea because it doesn't hold it close to your face anyway.
Right. I mean, for the most part, if you're going out in public, you're not using the medical grade masks. But at like for our hospital, for example, oh, I wish I had one to show you an example of. But we have the N95s that go like this. They're in a circle, and they do all this testing to make sure that no air is coming in or out. But the men who have facial hair, they either have to shave or they have to wear the entire hazmat suit because the mask won't give them the full seal that you need to be truly protected when you're seeing patients.
Now,
So, yeah.
Stephanie, why have I never, I don't know about anybody else that's paying attention. I consider myself a nerd with the news. Never ever heard that before.
Maybe
Never
because
heard that.
the ones in public are more like surgical masks that you tie, so it's not a full seal. But to me, it stands to reason that if you're trying to contain this
It's
area,
pushing it away.
exactly.
Now, what about the bandana? Because, like, I put a bandana on, we all look like a bunch of gangsters. Is that now? I was telling you this earlier, but I've noticed that I have become a complete awful person in stores. I know this is bad. I'm not afraid. I am not worried about getting it. I've been through so many things. If I'm supposed to go, it would have happened by now. That being said, I follow the rules and I wear some sort of a mask or a bandana.
Right.
And I notice that I'm getting very angry,
Yeah.
and uh, I'm yelling at my family, and I'm annoyed with everybody. And then I come home, and I noticed the other day that I believe I was starting to have a panic attack.
Yeah.
I have asthma and I've got all sorts of problems, but I would lay down on the sofa, and I'm absolute the worst person to be around. Been having headaches for about a week now.
Hmm.
Is Can you have a panic attack from wearing a mask?
Yeah, absolutely. I mean, we see a lot of people, everyone is predisposed to anxiety right now because this is just a scary time and it's difficult to know what to believe. I honestly feel like in some ways it's easier for me because I'm firsthand witnessing everything, so I know exactly what's going on. But if I weren't in the medical field, I might not know who to trust, right? So there's a lot of anxiety over the uncertainty of it all. But then you add a mask on top of that, especially someone with a lung condition. And when you start to feel like maybe I'm not getting enough oxygen, maybe I'm not getting enough air, then it spirals into a panic attack. So, I mean, I think that's happening to a lot of people.
Well, so is the solution obvious. Well, Jody, stay on the sofa and don't go shopping and buy everything on Amazon. Is that the solution and the only solution to that?
For right now, I mean, it depends on how long you can tolerate wearing a mask. If you think you could do a 20-minute shopping trip, then the mask might be appropriate. But like we're doing everything on Instacart. I don't know if that's a thing in Pennsylvania, but
Yeah.
everything gets delivered. So we're trying to minimize going in stores, just period. But I think that's the only solution I can think of right now, unless someone comes up with something better. Because when you wear a mask, what you're actually doing is showing the ultimate amount of compassion to your fellow man. You're saying, I love you as a neighbor, and I don't want to jeopardize you getting this virus from me in case I'm carrying it. And so it's really more about not spreading the virus than it is getting it, if that makes sense. That's what the masks are designed to do, is to stop the spread from person to person.
I feel like if and it could be me, but I feel like if it was explained more the way that you just explained it,
Right.
I I would still have panic attacks, but I would think that more people would understand that this is not a political thing.
Right.
This is a common sense, not being an asshole thing.
Exactly. Right.
You said being a compassionate person
Right.
and not putting somebody else in danger as you
Exactly.
would not want your family in danger. That's the point of the mask. And
Exactly.
because when this first started, I thought to myself, being a business person, oh, I'm going to make a monkey inspired mask.
Which I
But
would totally buy, by the way.
see, and it's funny because I'll tell you something. We had a meeting. One of the guys that I work with, we had a meeting, and the team was talking about doing this. And then I really felt I would have been capitalizing on a pandemic, and I couldn't do it. But
Mm.
then immediately it became what I believe is more of a fashion statement than it is a statement of respect. Um, and so I still have an issue with it because I feel like it's skeevy in so many ways. And I probably shouldn't. I should probably think,
Yeah.
well, whatever, they're wearing whatever they can wear.
Right. If y'all
But
came up with a good mask that was, monkeys inspired, you need to think of it more of as a public service. Because what I tell people is, when you're little and your parents are raising you to be a polite human being and you cough or sneeze, what do they tell you to do?
put your hand over your mouth.
Right? It's because it's just basic physiology that if you're covering your mouth when you cough or sneeze, then you're not making other people sick. So this is just taking that to the next level because we have found that you can carry it not knowing that you have the virus and you can just spread it to people by talking. So the mask is just the version of this that we can do right now.
And see, I was fat when I was a kid, and we used to eat a lot of fast food. And so I can completely understand a masked person because it's no different than talking into the McDonald's drive-through when they're like,
Right.
and I'm like, I know exactly what they just said. Believe it or not, but the drive-throughs prepared us for the pandemic, right?
Thank you, McDonald's.
Thank you, McDonald's. Now, here's another thing that I keep bringing up. Because it's really just my husband and my kids that I'm talking to every day.
Right.
And, I'd read a long time ago, when I was a kid and way before you, there was a little girl, her name was Baby Jessica, and she fell down a well.
Oh, wait, I think I remember something.
This was, I had to have been a kid.
Yeah.
And because I consider myself a detective because I watch a lot of forensic files, I did a lot of research that said that people that are considered a lot of people that become heroes, like the person who saved Baby Jessica from
Right.
the well, killed themselves, and that it's a very high suicide rate.
Yeah.
Because people that are considered heroes many times, and I don't know if other people realize this, that is a burden, not a burden. It's a lot of pressure because they started doing research on paramedics and such that said they get addicted to listening to like the radio calls for the police and stuff because they feel this, and it's psychological, they can save another person.
Right.
I don't know. I respect everybody in the medical industry, and using the term hero over and over and over again, I'm a little bit worried because they're not addressing when they had the doctor last week who committed suicide, who had coronavirus. And I
Yeah.
said to my husband, there's going to be a lot more of this in
Yeah.
the coming years, because when you give people hero, 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 hero title,
Right.
they may freak out, flip, whatever, when they are no longer either needed
Right.
or they lose somebody under their watch.
Yes.
Do they train you or teach you in medical school this stuff?
No, I mean, I don't think anyone could have anticipated this situation, but no, you would hope that they do. They teach a little bit of maybe about self-care and well-being, but I mean, you're very, very astute in what you just said. When that ER doctor from New York killed herself, I'm not suicidal, but in an instant, I understood why, if that makes sense. Because my first week treating coronavirus patients, I mean, people are honking and they're clapping and they're calling you a hero, and it's a very adrenaline fueled experience. And when I came off of working for a week, a very intense week, I was very lost for a few days. I felt like all of a sudden I had no purpose, even though I should be enjoying being at home with my husband and my baby son. And I had to go through a lot of work. I had to talk to a counselor about it. They have not prepared us for anything like this because, two things are happening. First, when you get this incredible sense of purpose and you lose it, you kind of lose like, oh, well, do I not have a point? Is there a point to me anymore? And then second of all, the hero moniker, which is incredibly kind and generous, also puts this crazy amount of pressure on doctors and nurses and medical providers who get sick and then they go right back to work. And I just want everyone to realize that doctors are very human, and not to have these unrealistic expectations about what we should be doing. And then we feel like we should be living up to this certain standard. It was a lot to go through. When I tell you, there was a very intense month for me. Like I went from high to low to high to low. I had issues with my depression coming back. It was just a lot to take in emotionally because you feel like you're saving the world, and when you come home, you feel like, well, I'm not doing anything to save the world anymore. So what's the point of me? It was just a crazy, crazy time.
I wonder when I first started doing sales in when I had a real job, I felt like this adrenaline and this guilt if I wasn't in work. What
Right.
was I missing? What could I have done differently? Oh, we would have made our goals. I lost this.
Yes.
And
It's the
um,
same thing.
you don't want to take off and you
Right.
don't want to miss anything because you literally feel like you're missing something.
You do. And you feel like, oh, is there one more person that I could help and I'm not doing it right now? And then the other flip side of that is, people call you a hero, but we have no treatment, we have no vaccine. So sometimes we feel helpless even at work because it's like we're doing our best, but we're watching so many people suffer that it's difficult to feel like a hero when you truly cannot save everyone.
I'm more afraid of the psychological damage that's going to be done
Yeah.
to the people that are lonely, the marriages, the medical people, my kid who is not going to be in school for a full 6 months.
Right.
I mean, I feel like that's if they're going to have press conferences and drill this down our throats, I feel like they're missing the bigger picture. Like they're so busy talking about the masks, which are extremely important. There's nobody's really spending the time talking about the long-term psychological effects, especially on doctors. One of the things that really when and again, I don't want to cause problems, but when I sit at home, 80% of the television commercials are lawyers that are medical malpractice lawyers.
Right.
When this whole thing started happening, I said to my husband, I would be petrified if I saw Rand Spear come in my emergency room because he's been on television for 20 years. I would not want to. I know you have the Hippocratic Oath, but I would be petrified because of the lawsuits. Like, it's there. CNN is telling us respect the heroes, the heroes, the heroes, and then you've got them sponsored by these law firms
Right.
that are talking about, have you been injured at work? Like, we don't have enough doctors and nurses, and then it's sponsored by attorneys that are trying to sue the people that we need the most right now.
Right.
Do you guys ever feel that
We
pressure?
do. Yeah. I mean, right now, everything is so haphazard. There's no like uniform treatment protocol, even among hospitals in the same city. So that that is something that I've actually brought up with some of my colleagues. Like, what is going to be the long-term ramifications of people looking back on this with 2020 vision, for
Right.
a pun, and saying, "Oh, you should have done this, you should have that," when like we're in a metaphorical war on the battlefield, just trying to put band-aids on things. And I am worried. It's not changing my practice, of course, but I am worried that some lawyer is going to try to capitalize that on the future, saying, "Well, Dr. McSharma, you should have done this, you should have done that," when they're not here living the front lines of what we're doing, just trying to support people through this so they can recover. So we have talked about it, but at the end of the day, it's like, well, we just have to do our best because this is not something that we've ever seen. I've never seen, in my career. So you just have to do the right thing and hope that nobody takes advantage of it later.
Are you now glad that you became a doctor, or are you more like, why did I do this?
That's a long story because I never wanted to be a doctor. But I met my husband because I'm a doctor, because I was never would have been at the place that I was when I met him. And I'm very blessed to have the privilege of treating people right now. So it's hard to say. I mean, I can't imagine my life differently right now. The main thing is I didn't want to be a doctor because I wanted to be an actress and a writer. So I'm doing that.
Well, you'll just fall back on being a doctor.
Exactly.
It's different in California, where everybody that waits on you is also up for a part.
Right. Exactly. Well, now it's like, hey, maybe they need more doctors on TV because everything's about coronavirus, and maybe it'll be my big break. I don't know. But I mean, there's part of me that's very glad to have this firsthand information because it's able to provide a sense of solace and comfort to all the people that I know and love. So I can't knock on that.
No, it's I just think I watch the news. I also when I was in college, I had a political science teacher that said I looked at things like kind of ass backwards. So I don't look at the disease as much as I look at the ramifications of what's going on
Right.
to every single person that's there. I mean, when I had emergency surgery a couple months ago, and then I had to go back into the hospital right when this corona thing, like, the hospital, thank God my doctor had them take me right back to the CAT scan, because when I walked in there and I saw what was going on, the bathrooms looked like the bathrooms at Walmart. Like, it looked like it was filthy in the hospitals. And I was like, I just want to get the hell out of here as fast as humanly possible.
Right.
And that was just the beginning
Beginning.
of
Yeah.
this nightmare, that I didn't want to be there. If I right now had the same pains, I would drop dead in my house. I would not go
Go.
to a hospital right now. I mean, I have such respect for you. And, I watched you get married. I watched you be pregnant. I watched your baby be born, watched you become a doctor. And I really was shocked when I saw that you were going back to work, because
Yeah.
you had just been on maternity leave. And then
Yeah.
this was what you went back to. And I really thought She's not going back to work.
I
No,
thought
no,
about it,
baby.
but I didn't want to do that to my, fellow doctors, because if one of us doesn't work, that means someone else. It's so weird because we have all the precautions at work so far. Thank God, we have all the personal protective equipment. Maybe I'll be wearing a monkey's mask to work. I don't know.
I think I might know somebody that knows somebody that might be able to
Okay.
provide that for you.
But I think for me, what was so emotionally difficult, like when you said that you get angry when you go to the stores and things. Like when I started seeing people protest, like, oh, this virus is a hoax. Oh, this is, we're being lied to. These numbers are inflated. I'm not going to wear a mask. My freedom's being imprisoned upon. That's when I got very hurt. Honestly, I had to take a couple days because I felt like, look, I'm in the situation where I'm putting my health on the line and the health of my family. And this is how you're thanking us. Like at one moment, you're clapping for us, and the other moment, you're stabbing us in the back by saying and acting this way. And it took me, actually, I may not be over it, but for a while, I got really, really down because I felt so betrayed that my daily life was me putting my health on the line along with all of my colleagues. And it seemed like people didn't want to do these basic things in order to protect us, you know? So, and I lost a coworker. I lost a coworker to coronavirus, an ER nurse at our hospital, and it was awful. He was late 40s, maybe early 50s, and it's difficult to see what I'm seeing every day at work, and then to hear some of the things that people say.
What are they going to do for the medical staff? I mean, I imagine, I know that when a police or a firefighter lose somebody, or they're in some sort of dangerous situation, that they have to go to counseling or do
Yeah,
desk work.
yeah.
Do they have a plan in place for you guys? Have they discussed that with the unions or anything?
Not really. The company that I work for, they have been really good about, like, you really need to take care of your well-being and your wellness. If you need a counselor, here's the number. Here's the peer support program. That's just for the company that the doctors work for. Hospital wide, I don't know that anything has really been instituted. Yeah, one of my friends, who's also a therapist, described this whole thing as a community-wide trauma. So I think we're all experiencing layers of trauma right now together, and it's going to take a lot of attention to come out of it with any sense of normalcy or happiness. This is hard for everybody, every single.
Right.
Yeah.
But I think that I watch a lot of social media is like the best and worst thing for somebody like me, because I have a very big mouth. And when I see
True.
people complaining, oh, day 81 of quarantine, sitting on my sofa watching television. And a couple weeks ago, I really flipped out because I was reading these people bitching. And then I remembered that, like, I had somebody in my family that went through the Holocaust, and, like,
Mm.
really, you're really upset. Listen, there's a reasons a lot of people are upset, but there are a lot of people that are complaining just to think that they're raising an eyebrow on social media, not realizing how
Yeah.
irresponsible and stupid they're actually looking. I mean, you
Right.
you have food, your family is safe. What are
Right.
you bitching about? Sit down,
Right.
shut up, and just wait until you're allowed to resume things as usual. But it really has, we had talked about this before. We're all in this together. And it's a tagline.
Yeah.
That's all it is. It's a t-shirt. It's a tagline. It means absolutely nothing, because I
Right.
don't feel the community. Now, after 9/11, I did. After 9/11, people put the flags up, and they were, I did feel it at that
Yeah.
point, even though it was because it was America versus everybody else. it
Right.
wasn't it wasn't like it was that we hated everybody that was a foreigner. That's why we all banded together. This, I don't feel that.
Yeah.
This, I feel like not at all community.
Yeah, I felt it. The 9/11 comparison is interesting because I I was actually at Buckingham Palace of all places when 9/11 happened, and it was part of my senior study something. And so anyway, after 9/11 happened, I just felt this amazing sense of um, community and patriotism, and just so proud and humbled to be an American. But a couple months later, it was very like 9/11 turned into a political thing where people were just barking at each other again. That's kind of how I feel with this. I felt like the first week or two of coronavirus, it was like everyone was hunkered down. Everyone was praying for the medical people, staying at home, following orders because everyone was scared and wanted to survive this together. So actually, I did feel that right at the beginning. But now it's a month or two later and I'm feeling that same. It's been politicized, it's become a polarizing thing, and it's wild to me because I'm like, this is science. The virus is not political, it's a disease. And so we should all be doing everything we can to survive it and to prevent it from being spread. So I don't know, maybe it's human nature, but I definitely feel like there's a lot more disagreement and contention, especially with these conspiracy theory videos and things that are kind of actively working against us. So it's like we're fighting a virus on one side and then we're fighting misinformation on the other side. And in the middle, you just have people like me who become so exhausted that we have to unplug before we lose our minds, you know?
That's exactly what I'm seeing. If you don't want to lose friends, you have to you have to stop. And I've been saying I'm starting to see a lot of people crack. I've noticed that people are becoming more bitter, they're becoming more angry, they're losing their patience, they're bitching about things that make absolutely no sense. And I've noticed that this is human nature. We're not supposed to be stuck in the house the way that
Right.
we technically are.
Right.
Um,
We're not supposed to be isolated from each other.
but at the same time, I call the Chinese restaurant the other day. All the Chinese restaurants in my area closed except one. And I'm assuming they closed because business is down. They can't afford to keep the doors open. And I called the one Chinese place and I said, "Hi, can I place an order for delivery?" And the woman yelled at me. And then I subsequently yelled at her and slammed the phone in because I thought, you know what? The small businesses that are open should be a little bit more respectful also because they're lucky that because so many of their competitors
Why
are
did she yell at you?
because you know what? I don't, this is what's been going on. I watched two women at Walmart with their masks on and their gloves and their bee costumes, and they're all protected, yelling at the woman who was scanning the stuff. And I just, I'm going, they took all the time to protect themselves, but can't take another second to be patient for the
Right.
person that's helping them.
Right.
And another thing is that, growing up, like my parents taught me, you want your kids to be doctors and lawyers and this and this and this. And yes, you do. But what's funny is that my kid wants to be a cook. My middle son wants to be a cook.
Right.
He's working at a deli.
Hey, Cheryl.
Right?
Sorry, she just said hi. Go ahead.
Oh, she's working at it. He works at a deli. He works 6 days a week, about 60 hours a week now.
Oh, wow.
My kid is essential. Where we were teaching
Wow.
all of our kids years ago, no, you want your college degree and you want this and this. We have the people at Walmart and Wawa and 7-Eleven, and
Yes.
those are the important people now. And
Yes.
and everybody else is relying on them. It's
Right.
such a shift in who you should give respect for these days.
I,
It's
that's a good thing, though, that's coming out of this. There are some good things coming out of it. Um, I was thinking about some very wise people once said, "We were born to love one another. This is something we all need."
and things. Go figure,
I know.
right?
And
It's
when people complain about wearing the masks, I want them to realize that when you wear a mask to a store, what you're actually doing is also protecting the people that work there. It's not fair for someone like your son to be going to work in an unsafe environment. If none of the customers are going to wear masks, then that's putting his health at risk. and then he could bring it home to you. So it's all about having each other's back right now. We just need to have each other's backs, plural.
That's what the mask should say.
Yeah.
Instead of Rolling Stones on it, it needs to give the bigger picture, which is, this is we're doing this for a reason.
Right.
And it's not about, it's not about celebrity. It's not about not wanting to get one person or two people sick. It's everybody. I mean, I was telling you, we have a Comic-Con that has not canceled yet.
Wow.
That it's 100,000 people. Well, I mean, we can put our bosses behind plastic.
Right.
But what about the people in the line?
Exactly.
I know myself. Like, I know I will be fiddling around with this.
Right.
So everybody else will be too, because that's common sense that that's going to happen. To stand in a line for 3-4 hours, it's not healthy for anybody.
Right.
We should wait until it's a better situation.
Exactly. That's the bottom line. We just have to wait until it's a better situation. Absolutely. Like, I wear my mask for you, you wear your mask for me. That's how it should be.
I've as much as I complain about it, and listen, it's my choice. I just won't go in the store if I can't deal with it.
Right.
But it is the smartest way to go. And we shouldn't be narrowing down who we don't want to get sick. We don't want to get anybody sick.
Anybody. Exactly. Anybody. Yes.
So I respect, Mike and Mickey need to stay home because they are in that age demographic. We all are. Every one of us are. Think about yourself. This is actually the first time we should be thinking about ourselves and thinking about other people, putting ourselves first, because if it doesn't happen with us, it's just not going to happen with anybody.
Yeah, absolutely. And when people say, the people at risk, well, you can't look at someone and know whether they're at risk or not, because the risks are high blood pressure, diabetes, asthma, COPD. And there's plenty of people who look healthy, are younger, who have some of these conditions that predispose them to get sicker. And like I said, like in that example, I had a young patient with no diseases, and that person got very sick and had to go home on oxygen. So
what about people that chain smoke?
Yeah, that's not good.
I mean, isn't that just like flipping the middle finger off? Because you smoke and you inhale that, you're beating your lungs up, and then if you get this, you're going to take a respirator from somebody potentially who did take care of themselves and didn't abuse their lungs.
Yeah, I mean, that's true on so many levels, not even just coronavirus, but this is a disease that is not friendly to the lungs. So everyone should be pulling out all the stops that they can to take care of their lungs, because you want your lungs to be as healthy as possible.
I personally cannot thank you enough. I mean, I watch you and I follow you, and it's so funny because I know people are probably more interested in the kind of like stuff that I get to do because it's fun stuff.
Yeah.
And yours is not so fun.
Yeah.
But at the end of the day, I would rather know that there's people like you out there, because first of all, you do so many different things. I really hope people start following you, and your sister is brilliant as well.
She is. She's the mom.
She's more in the political area than you are. I mean, your parents did very, very good, and
I'm going to have to tell them you said that.
I watch them all the time. I can't believe them. But I just want to thank you so much, because, what you did tonight, which I know is your night off of work, and you're talking about work, but you pointed so many things out that I have never heard on television. You gave me, and I hope other people, a new respect for themselves for doctors, for, you signed up to be a doctor. You knew what you were getting yourself into as far as, well, I'm probably going to see a lot of sick people and dead
Right.
people and stuff like that. The part about being a hero, though, I don't think that that is something that your community of people are going to bounce back as well as the general public. And I don't think you're ever going to get the respect um, that you really deserve. And I really hope that they do something. And I hope you yourself take advantage of the help that they can give you, because I don't think people realize that healthcare workers, they kill themselves more
Yes.
than us being depressed. Because I mean, like, I'm depressed because my husband watches Parks and Recreation reruns all day long, and I'm depressed, but I'm not going to hurt myself. And I
Right.
do think a lot of healthcare workers are going to, and I wish that the media would discuss that a little bit more,
Yeah.
because people that don't read don't know that that's a big problem in your community of work.
It's a huge problem. And, we try on the Facebook page that I have, I try to post videos as often as I can, just trying to humanize this entire experience so that people feel like, oh, that's my friend Jaya, and this is what she's going through. And so sometimes I feel like a friend or a fellow Monkeys fan, is so much more relatable and maybe more easy to trust than a huge corporate organization whose motives you may or may not know. So yeah, I appreciate that. We do some fun stuff too, not just coronavirus doom and gloom. So hopefully you get to enjoy that too. But thank you for saying that. I really appreciate it, and I've appreciated this conversation. I'm happy to talk about it because I want people to have the information to help themselves and help other people. So, excuse me, that's my sister. I'll just call her back.
Hi,
Okay,
sister. People have to, I'm
there
going to
you
have
are.
to talk to her I'm going to have to talk to her as well at some point. But
Yes, you
I,
should.
I just, I really appreciate you. And I'm so glad the reason that I wanted you're my Sanjay Gupta. I got my own here, right?
Yes,
But
yes,
but I feel the same way. Monkey fans, we have a commonality. And
yes.
there is a trust. Like, maybe that's why I hug them all, Like, it doesn't matter if they're fat, thin, black, white. I could care less.
Right.
Every single person until now, I hug,
Right.
I embrace, I talk to them, because I feel like we have something in common. And that's why I felt like, no, I don't agree. I didn't agree with everything that beforehand we were talking about. But I trust you because I know where you're from. And I feel like we are meant to be together. And I think a lot of other people will understand that. I have a lot of friends that are in healthcare, and I'm petrified for them. I
Yeah.
don't tell them that. I
Right.
don't tell them I'm scared for them, because truthfully, they're protecting themselves better than 99% of my other friends are, in-
Yeah.
including the people in my house, including myself. So you kind of made me see things. And I'm sure I'm going to be getting some of my very close friends that fight with me all the time about, don't go out of the house because you're loved. And if anything happens to you, everyone's going to be depressed. And now I think I understand a little bit better that,
Oh, good.
yes, so
We
you've
need
made
you
it.
around. We need everyone around.
Listen, I am so bored at home now that I was looking at the Ellen DeGeneres clothing collection at Walmart. First of all, I'm not a lesbian and I don't shop for clothes at Walmart, but it's the only place that's open
Hey, I
now.
have some of her shoes. They're fantastic. I love them.
The only funny story I'm going to tell you is that I went to Comic Con once. Shirley Jones from the Partridge Family is there, and she's doing an autograph signing. And I look at her shoes and I go, "Oh, I have the same shoes." And she goes, "I have 7 pairs of them. They're the most comfortable shoes." And I'm thinking, yeah, because Josh would make fun of me that I had old lady or lesbian shoes. And I was like, Yeah, see, so I call him on the phone. I go, yeah, I told you. Shirley Jones has 7 pairs of them. And he's like, isn't she 90?
What kind of shoes are they?
They are just the most comfortable. I'm going to
Yes.
send you what they are.
Okay.
But I was excited and he put me back in my place. And she's the old lady from the Partridge Family. I'm right, Jody, and you're wrong.
Aw, come on. I
But
can't wait. I
listen,
can't wait to see a picture of them.
oh, believe me, you can wait. But no, because we're alike. So we
Yes,
find like that the Mary Janes are still adorable when our husbands are like, are you serious?
exactly.
But we're already married, so it doesn't matter what we look
Doesn't
like, right?
matter. Yep.
Is Ari coming back?
No, he's asleep. I'm sorry.
Okay. She's
Yeah.
got the most adorable child I've ever seen.
If we
Um,
do this again, I'll have him like here right at the beginning.
can you? Because you don't understand. Some of the little videos that you put of him laughing make me laugh.
Yeah. Aw.
They
Yeah.
do. He's his little chubby cheeks and he's just laughing, and it makes other people smile.
He's our
So
he's our own little Gerber baby.
you really you are the full total package. You really are. If your husband breaks up with you, I want you to call me because I could,
You hear that?
hear that, Jacob?
He doesn't hear it. I'll tell him.
Thank you, thank you, thank you. I'm gonna let you go so you can go be with your husband.
Okay. Well, this
Make
was
more
so
gorgeous
awesome.
babies.
It's so great to see you.
It's so great to see you, and thank you for everything. Thank you for making me believe that I need to not go to a concert and I need to wear a mask.
Yes, so that we can all go to a concert in the future when this is not an issue anymore. That day is coming. We just need to make sure that we take care of ourselves and each other until that time.
And I'm going to tell you one better. When the monkeys are able to tour again, and you are able to be at one of the shows, I'm going to give you the every treatment that I can possibly give you to thank you for everything that you've ever done.
Coronavirus, worth it.
So yes, you go flip patients over and I'll give you a microphone and you can sing any song that you want to with Mickey at any karaoke that we ever wind up doing again, just
Oh
because
God.
you are such a rock star and you're awesome.
Thank you so much.
No, thank you so much. And just remember you're very important and no matter what happens, you're the best. Thank you for everything.
I'll probably rewatch this later whenever I'm not feeling so great about myself. So thank you for this.
Don't worry, you're always my hero, and that was because you were on stage singing with the monkeys. Had nothing to
Exactly.
do with this. All right, my sweets. Mwah, I love you. Kiss
All
that
right.
baby.
Love you
And
too. Thanks, Jody.
thank you.
Thanks, everyone.
Bye, my love.
Bye-bye.
Bye, sweetheart. Now I'm going to wear a mask. And I hope you learned something. What I learned tonight was that facial hair does not keep the mask completely against your face. I did not know that. And also, do your research. Medical people that are in the medical industry, firefighters, doctors, I'm sorry, police officers, paramedics, people that are saving lives have the highest suicide rate of anybody because when they think they're a superhero and they are superheroes, but when they go on down because they start getting addicted, thinking that they can save everybody. It's a mental game that you should check out because you'd be really surprised. I was shocked, but that's what I'm studying, for. So anyway, wear your mask or order in, and you guys are awesome. Thank you so much. I don't ever ask this, but I would share this with your pages because there's a lot of things that Dr. Jaya, told us tonight that I don't think the media is telling us, and you might be able to help somebody else. So anyway, on Monday night, Coco Dolans is going to hang out with me, and we can ask her a whole bunch of monkey stuff and Mickey stuff and all that. And John Billings is next week also. And so thank you so much for hanging out with me. I'm going to go back to my family, and I hope that you learned something. But please share this. Let people know what we learned tonight, that it's not just about us, but it is about us. And thank you. Have a great weekend. See you Monday.